The larynx is commonly referred to as the voice box. It connects the pharynx to the trachea, which is the windpipe. Therefore, it serves as a passageway for air, but also passageway for the digestive system. That's why it's stratified, non-keratinized stratified squamous epithelium. So it prevents ingested materials from entering the trachea and bronchi and produces speech. It has ring-shaped cartilage called cricoid cartilage, which is just inferior to the thyroid cartilage. And finally, it has the epiglottis, which is elastic cartilage, and it's a spoon-shaped cartilage that projects superiorly into the pharynx. Swelling causes the epiglottis to close the opening to the larynx to prevent food from going into the trachea. So now for the lower respiratory tract, this is going to begin at the trachea, and it's going to contain still conducting portions and respiratory portions. So it still conducts air because there's no gas exchange that happens at this point. So the conducting part, the no gas exchange part, is going to begin with the trachea, and it's going to continue into the bronchi, the bronchioles, and then finally end with the terminal bronchioles. So again, the conducting zone means that there are no alveoli present. So no gas exchange can actually happen. After the terminal bronchioles, we then enter into a zone called the respiratory zone. And in the respiratory zone, there are the presence of alveoli, so gas exchange can occur. So it begins with the respiratory bronchioles, which has a few sparsely located alveoli, alveolar ducts, and finally alveoli. So you should know what the conducting zone is and what the respiratory zone is. The trachea is commonly referred to as the windpipe. It's anterior to the esophagus. So when you feel the front of your neck, you can feel the cartilage rings wrapped around the trachea. So the C-shaped tracheal cartilages that you feel. So if you actually look up towards the ceiling, you touch your windpipe, you'll feel the trachea there. And those are the C-shaped tracheal cartilages, and their job is to prevent the trachea from collapsing. Posteriorly, at the posterior region of the trachea, there are cartilages that are connected by a specific muscle called the trachealis muscle. And the trachealis muscle's job is to allow the esophagus to enlarge into the trachea. So when we are digesting what's called a bolus of food, and as it starts to travel inferiorly down the esophagus, that region where the food is located is going to expand anteriorly into the trachea. The mucosa of the trachea is pseudostratified columnar epithelium, and sometimes it contains goblet cells, which produce the modified protein mucin. And the function of the mucin is to help to kind of latch on to bacteria so that we're able to get rid of it. We can either hack it up or we can also swallow it. Then at the base of the trachea, there's a split or a bifurcation where it splits into the main bronchi. That point where it splits is called the carina at the bifurcation point. On this image here of the trachea, where the transverse or cross section is here, we can see the trachealis muscle in the posterior region of the trachea. We can also see the 4 different layers here, which are the mucosa, submucosa, hyaline cartilage, and adventitia. It's the hyaline cartilage that are the C-shaped rings, which help to keep the trachea open so that it doesn't close. As we enlarge the mucosa, we see an image which looks like this one. And it's important for you to know that it is pseudostratified, ciliated columnar epithelium. And the cilia is very important because it helps to sweep bacteria and particles in a superior direction so that our body can get rid of them. And in fact, they are part of what's called the first line of defense for the immune system. Also shown is the second layer, which is the submucosa, and it doesn't show the third and the fourth layer, which would be the hyaline cartilage as well as the adventitia. So in the image to the left, you can see the trachea with the tracheal cartilages. And when it splits at the bifurcation, it becomes the left and the main bronchi. So the bronchial tree is a highly branched system of air passageways that branch more and more and become more and more narrow. So they begin at the main bronchus. There's a right and left main or primary bronchus. Each main bronchus breaks into a lobar bronchi, which is also called the secondary bronchi. Then it's going to split again into the segmental bronchi, which are also called the tertiary bronchi. And the main bronchi would be the primary bronchi. So this diagram is showing us the bronchial tree. So we can see the right main bronchus here first, the left main bronchus, the right lobar bronchus or secondary lobar bronchus, right segmental or tertiary bronchus, as well as the left segmental bronchus. And then we have smaller and smaller bronchi, which lead eventually to bronchioles. So the bronchial tree has many levels of branching, and those bronchi include characteristics such as incomplete rings of cartilage. So the cartilage starts to disappear. Remember, it's present in the trachea, then it starts to disappear in the bronchial tree. The large bronchi are lined with pseudostratified epithelium, but then that is replaced with columnar epithelium. And now there's rings of smooth muscle, which replaces the cartilage. So the cartilage is no longer present. And as we get smaller and smaller into bronchioles, those bronchioles are going to contain smooth muscle, which help to keep the bronchioles open. And contraction and relaxation of these smooth muscles results in either bronchoconstriction or bronchodilation. The bronchoconstriction is usually something that occurs with the parasympathetic nervous system, and bronchodilation is something that occurs with the sympathetic nervous system. So the final segment of the conducting zone is the terminal bronchioles. There's no alveoli present, so no gas exchange actually occurs.